Collin County's COVID-19 numbers went from 4,600 to 100 overnight after an audit. Collin County, Texas revised the disclaimer on its COVID-19 dashboard to acknowledge the Texas Department of State Health Service is working to make the data as accurate as possible. A week after adding a disclaimer saying that the county does not have confidence in the accuracy of the data being provided by the DSHS, Collin County Commissioners unanimously approved the revision during their 24th August meeting. Collin County Judge Chris Hill said that he has had significant conversations with the DSHS officials about their plans to address issues raised by commissioners. After the revision to the disclaimer was approved, Hill explained that the DSHS plan to set up a Collin County work group August 25th that will be committed to recidifying the county's backlog of cases. Hill said the work group will be checking whether patients currently classified as active cases of COVID-19 have been symptom-free for 10 days. So then they can reclassify them as recovered. He also explained that if the group is unable to reach a patient after 3 attempts, they will be reclassified as recovered. Earlier in the meeting, Hill motioned to revise the disclaimer to read, "Notice, Collin County is providing COVID-19 numbers and data as a convenience to our residents. However, Department of State Health Services officials have acknowledged that the active case count for Collin County is significantly overstated. We advise residents that Collin County lacks the confidence in the data currently being provided to us. DSHS officials have agreed to immediately redirect resources to correct the issue, but have not yet provided a timeline on when their reports will be corrected." Now, what first tipped off officials in that county to the numbers being askew was that in order for them to have 4,600 cases, the majority of their hospitals would have had to have been overrun, and they simply did not see it. And so they requested an audit. Now, there was also a number change with the CDC's total amount of deaths as well as active cases over the past week. Atlanta, Georgia, the Centers for Disease Control and Prevention released new data last week that depicts how many Americans who have died of COVID-19 also had contributing conditions. According to the report, only 6% of the deaths have COVID-19 as the only cause mentioned, revealing that 94% of the patients who died from coronavirus also had other health conditions and contributing factors. It makes you wonder, if the numbers are so easily put in incorrectly, then who's to say that any of the numbers are accurate? This is Felicia Lockhart, and this has been the Lockhart Perspective.